The management is what? Recognize that these pregnancies are at risk of any one of these complications, take them very, very seriously,
Yep.
And do ultrasound scans at very regular intervals by people that know what to look for and to act on their findings. Often, unfortunately, I keep hearing that a woman turns up, she complains of pain, and her healthcare professional may tell her, don't worry about it, it's twins, and that's why you're feeling pain. And then the next week she miscarries because they failed to recognize that the discomfort was a consequence of too much amniotic fluid. Or the woman says, I'm not feeling the baby's move, or I'm not feeling one of the baby's move. And you say, don't worry about it, drink some chocolate drink and everything will be all right. Well, the chocolate drink will not cure anything. All you need to do is have a scan by somebody that knows what to look for. And then based on your findings, then you tell somebody, go and have a chocolate drink because everything's all right. Or off you go to a center where they know what to do and intervene and save the babies that would otherwise be dying.
Yeah. And it's not enough to just do monitoring. It needs to be good monitoring by somebody who knows what they're looking at.
Yeah, you don't do a scan just to measure how the baby is growing or to look at whether the baby has a hair, lip, and cleft palate. That should be done as well.
Yeah.
But actually, you need to pay a lot of attention, knowing the three important conditions: twin transfusion, selective growth restriction, and TAPS. And look at each and do the measurements and also do the blood flow measurements, the Doppler in the umbilical cord, in the ductus venosus, a blood vessel that supplies the heart, and in the brain, looking for three different things. Is the baby lacking in oxygen? Is the baby lacking in hemoglobin? So you need to make a diagnosis to send them to the right place. But sometimes you don't even need to make a diagnosis. I cannot expect that every sonographer in England is going to become a super person, knowledgeable in twins, but they should be able to recognize what is normality and what is odd. And when they see that there's something odd, they must send somebody immediately, the same day, as far as I am concerned, to somebody
the same day.
And I always say, if somebody calls and tells us that we have an identical twin pregnancy and there's something odd, I tell them, not tomorrow, the appointment is today. And the women must come, even if it's at midnight, I don't care. They're going to stay behind and see the woman tonight, because if you ask them to come tomorrow, it may be too late.
It may be too late. Yeah. And I know of women that are left 2 days to wait for when they've got, symptoms and fluid discordance and size discordance, waiting 2 days for somebody to do a Doppler reading on them. And it's heartbreaking.
Every ultrasound machine has Doppler on it. And in the old days, when I was training, we did not have color on the Doppler. And we had to try to identify, for example, when we were looking at the blood vessels in the brain, we had to work out exactly where we expect the blood vessel to be, and then try and see whether you can get the waveform, the Doppler from that. But nowadays, you just press a button and you have color lighting up, which tells you, I am here. Put the Doppler gate on me, and then you will get a waveform.
Yeah.
It takes seconds. I find it extraordinary. All the machines in this country, in every country, have a Doppler element on them, and there are only 3 vessels to look at. And somebody who has trained in becoming a sonographer, they just need to spend 2 minutes more during their scan to do the Dopplers. There's no need to refer anybody to another center to do the Doppler. You can do them there and then.
Do the bedside sonography machines have this ability as well?
Absolutely, they do.